Hi, my name is Bilal Hijazian, and today I'm going to talk about exercise as a vital sign. We're going to talk about the content to look forward to see what we will talk about. We'll talk about Kaiser module features, encouraging providers to consider exercise, resources available for physicians, educating patients, using all the resources available for patients' benefits, and lastly, describing Dr. Salas. So, what features of the Kaiser model make the organization more likely to engage in proactive slash preventive care of the patient population they serve? Before we talk about this, let's mention a little bit about Kaiser Permanente. Kaiser Permanente is one of the nation's largest not for profit health plans providers, which serve more than 12 million members, founded, of course, in 1945. I should also point out that Kaiser Permanente is a health maintenance organization, or an HMO. It consists of 39 hospitals, more than 710 medical offices, more than 223,000 physicians, and more than 63,000 nurses. When speaking about proactive or preventive care, there are many sides, such as proactive blood tests and proactive screening, such as mammogram screening. But in Module 6, we will focus on physical activity and dietary. Now, Kaiser Permanente has many systems in place that encourage proactive care, like Electronic Information System, EMS, called Health Connect, payment module system based on a risk sharing agreement between Kaiser Foundation health plans, Kaiser Foundation hospitals, and Permanente medical groups. These features, alongside the fact that Kaiser Permanente is a health maintenance organization or an HMO that benefits the most when its members are healthy, not sick. Okay, so what are the ways to encourage providers to incorporate physical activity recommendations into their practice or treatment plans? Kaiser Permanente provides systems and information that would encourage physicians to add physical activity into their recommended treatment plan. It would be providing evidence based research which indicates that physical exercise provides better health, reduces a lot of chronic diseases ratings such as dementia and Alzheimer, and it would and other ways to encourage providers are financial incentives to keep their patients healthy, evaluations and ratings for providers who includes AVS or exercise vital signs into their patient evaluation. The integrated system and seamless referral for physicians when referring a flagged patient to the appropriate resources also help to lighten the burden and work on physicians, and which also helps to increase the adoption. So, what are the resources that should be available to physicians who recommend exercise to their patients? As mentioned before, evidence based resources and online tools should be available for physicians. Such tools would be a patient's health history, such as BMI, blood pressure, and the amount of time spent exercising. The information should be available to all physicians within Kaiser Permanente physician group, when needed, of course, to make the best recommendations for physician. Health Connect EMS in Kaiser Permanente system does provide to physicians all the information needed. So, again, what kind of education do patients need about physical activity so they would know what to do? Patients need a lot of education about physical activity benefits. such as the amount of time needed to exercise and the type of exercise that are recommended for their age groups. The Physical Activity Guidelines for Americans, second edition of course, endorses that for the age group from 6 to 17 to do 60 minutes or more of strenuous or vigorous physical activity. Also, physical activity guidelines recommends adults should do at least 150 minutes to 300 minutes a week of moderate intensity or 75 minutes to 150 minutes a week of vigorous intensity aerobic physical activity or an equivalent combination of moderate and intensity aerobic activity. They should also do muscle strengthening activity on 2 or more days a week. Older adults should do multi-component physical activity that includes balance training as well as aerobic and muscle strengthening activity such as walking and hiking. Now that physicians have access to exercise behavior via EVS data, what should they do with it ideally? The answer is very simple. Assuming physicians have the required training and knowledge, they need to recommend exercise as a viable and better option to reduce chronic diseases and to increase longevity of their members. They should refer patients who are at high risk to appropriate resources, endorsing patients and encouraging their colleagues to do exercise as well, as it is very beneficial for everyone. Now we're gonna talk about Dr. Salas. How would you describe Dr. Salas' leadership, and what leadership traits did he demonstrate in implementing the project? The first thoughts that I had when reading about Dr. Salas is that he is very persistent and very determined, and he's a visionary. He has a vision. Dr. Salas knows that this vision needs important organizations and strong leaders to support his ideas. It cannot his ideas cannot lift unless he has the support from other organizations and other leaders who share the same vision with him. The first national campaign, which was Exercise is Medicine, motivated him even more to reach for bigger support. He also knew what organizations to reach and how his vision of healthy patients would align in a sense with Kaiser Permanente, which in turn helped him to permanently put EVS as a vital sign in Kaiser Permanente electronic medical system. So, to recap, we talked about Kaiser module features such as electronic medical system, which is called Health Connect, encouraging provider to consider exercise by providing them with the resources necessary and the financial incentive necessary. Educating patients, such as the type of exercise that they should do based on their age group and the amount of time for need to spend on exercise for each age group. And we talked about also um, what should physicians do ideally when they acquire all the EVS data. And the answer, like I said, is very simple. They need to start implementing exercise as a prescription and recommended for all patients. Lastly, we talked about Dr. Salas and what he did for Kaiser Permanente and his vision what his vision as exercise to be prescribed instead of just recommendations. Lastly, these are the references. You can pause at any moment to check them. And thank you.